I don't know if I'll be as entertaining, but I probably don't have much to say after Dr. Chapa just gave us a wonderful insight into many of the side effects and problems with the transfusion. I'd also like to thank everybody here in this valley and greater Prescott community for turning out tonight, your great attention. It's rare to see so many public people come to hear a bunch of doctors talk about what could be potentially a really boring subject for you. But I think you live in a place where you're one of the few places in the world where you're really on this cutting edge. I was talking to Dale earlier today. I do a lot with the Australian government, and the Australian government has actually enacted legislation to change the way their country does blood transfusion. And in Australia, I talk about one place in the United States that carries the flag, and it's here at Prescott. So you guys are doing wonderful work, and I thank everybody for inviting me to come out and speak with you. So I'm going to talk about the conundrum of transfusion, physician and patient views. There are a lot of people, and there's a lot of organizations that have their hands in our business. You know that. The government always has their hands in your business. But there are lots of organizations that would like to tell us how to do the transfusion business and really try to influence what happens at the physician-patient interaction. And it is the physician-patient interaction that makes the difference to whether or not we do transfuse and whether we actually give the blood or we don't give the blood. Disclosures are something I'm supposed to do. There's nothing that has any financial effect on this talk. You and I go through life with a lot of nuanced decisions. Some of them are shades of gray. And maybe the blood transfusion decision ought to be one of those really nuanced decisions. However, I will put it to you that most of the time through the history of modern medicine, a blood transfusion was never a nuanced decision. It was taught to me when I went through med school years ago that give blood, can't hurt, might help. And that was the way it was looked upon. Now what you've just heard from a very educated group of physicians is blood might hurt a great bit. We don't know how often it's going to help. So once again, you've turned the paradigm upside down. And if you turn the paradigm upside down, everything else that we've been doing doesn't make any sense. So how many decisions are nuanced? And shouldn't the blood transfusion decision be highly nuanced? And every one of you certainly deserves the consideration of the physicians who are making that decision in a very physiologic way to decide whether you need it or not. The patient conundrum is that most patients in the United States, their only knowledge base of blood transfusion is what are driven by public relations campaigns and the lay press. And those are very slanted views that are out there, and they are completely opposite to what you've heard tonight. So how can the leaders in medicine be telling you this stuff, and the public relations campaign is give blood, it's good for you, everybody has to have blood? So some of the things that are said, and I'll show them to you, and you can go on any website you want, and you'll find them. I changed planes in Chicago yesterday, and there in between the C and the B terminal is a big ad for American Red Cross, and give blood, save a life. It's all over. It's in our enculturation in our nation. Blood is the safest it's ever been. How many times have I heard that? You just heard how unsafe it is. So what is it? Is it safe or is it unsafe? Well, if you want the public relations campaign, it's the safest it's ever been. But that's looking with a very little minuscule vision, which is, yeah, we're not seeing AIDS and hepatitis so much. But if Ebola got into the blood transfusion, you'd have a different view of it, wouldn't you? Or how about SARS? SARS is a virus out of the Southeast Asia that went and really almost attacked Australia in a big way, and it was carried in blood transfusion, is one of the ways you could get it. So when that shows up on the outskirts down in Prescott Valley and it's working its way up to Prescott, there's going to be a bunch of people running around being really worried about it. So here's the interaction between physicians and patients just before surgery. Here, sign this consent. At least in my hospital, we have to have a consent signed to have me look at your toenail, just about. But the interaction between the physician and the patient is an opportunity for education, but the situation often is that the physician is in a big hurry and he's not going to give you 2.5 hours worth of lecture on what the risks of blood transfusion are, because need to get on with things. So here's what the patients see. Anybody ever recognize that building? I walked past that building 2 weeks ago. That building happens to be out the back door of the White House. It's a huge white southern marble mansion right to the right side of the back of the White House, looking towards the Washington Monument. It's the American Red Cross headquarters, and it is built upon a lot of these PR campaigns, all of which came right off the American Red Cross website. This is all right off the American Red Cross website. So here's one that really bothers me a great deal. 5 million patients in the US need blood every year. Well, there's a word in there I have a great deal of difficulty with, which is need. The physicians give the blood, but most of the time we give the blood because we as physicians have a fear problem. And the fear is that if we don't give the blood, something bad might happen. And the bad thing might be that somebody might sue you for, letting their hemoglobin go too low. But that doesn't connote to need. And so it goes on and on. This is very, very powerful, very highly financed, very effective public relations campaign. And where do most Americans get their information from? TVs, USA Today, Time Magazine. It used to be Time Magazine. That's gone out the door. So the stakeholders in transfusion are somewhat scary. And here's you and me down here, the physician and the patient, trying to have some sort of understanding. But all these other groups and people are all trying to manipulate, okay? The government. Let's go to government organizations. They all get their hands into it, and all these organizations have a great deal to do with blood transfusions. Why would the Interstate Commerce Commission have anything to do with blood transfusions? It actually has the most to do with blood transfusions because moving blood between state to state is a big commodity. There are billions of dollars at stake moving things around. So it's about supply and it's about dollars. And all of that leaves us down here with this huge problem of how do we talk together. And so if you're a government organization, who do you turn to say, tell me about blood transfusions, risks, and what we should do? You go to two organizations, the American Red Cross and the American Association of Blood Bankers. You don't go to the people who were on the stage tonight saying, well, wait a minute, there's a problem. So we are really in this conundrum of what do we do and what do we tell patients, and how do you as a patient know what the right thing to do is? As I said, who does the government turn to? They turn to, to come testify in front of Congress. They go to the people who they think are the experts. But I'll put it to you that those people who they think are the experts have a bias. And perhaps they have a real conflict of interest. And perhaps it just isn't in your best interest as the patient to have that public relations campaign driving how the government's making their decision. And so who wants to control patient blood management now? The American Association of Blood Bankers, the people who are driving the supply chain. Would you have Shell and Texaco and Exxon controlling all the environmental impacts of the world, or how you would like, the future of transportation industry in the United States. So you got to wonder what's happening. And then here's the conundrum, which is transfusion is most often a human behavior based on fear. The actual decision to give the blood is a human behavior. It's a physician saying, I need to do something. Remember, I said, it used to be, give them a unit of blood, can't hurt, might help. Now the conundrum is, I don't know when to give the unit of blood, but gee, I feel a little squishy about, well, maybe this guy's not going to do so well if I don't give him a unit of blood. That's the science behind it. So hemoglobin levels, the things I started to try to talk to about oxygen delivery and stuff, they are not a decent surrogate for how much oxygen is getting to your tissues. But what do 99% of physicians use to do the triggering of when they're going to transfuse? They use a hemoglobin level. It's a perfect disconnect between physiology and reality and behavior.